Would you scroll past it?
You would.
Like get to the point. Okay.
Okay.
Yeah, see.
Okay. Hi guys, I'm
Aaron, and we're from Fit Clinic.
Today we're going to be going through the top 5 questions that I typically get asked as a podiatrist.
So, what is a podiatrist?
So podiatrist is part of the allied health profession. We typically specialize in treatments, treating, rehabilitation, prevention of any lower limb conditions or foot and ankle injuries more specifically.
Okay, so what does a podiatrist treat?
So typically we can treat anything from any skin conditions, bone, nerves, ligaments, tendons, anything really that has some sort of specialty with the lower limb or the foot and ankle.
What are the most common injuries you see?
A couple of common injuries. One, I'd have to say plantar fasciitis is a really big one. Achilles tendonitis, Morton's neuroma, really big one is flat feet. Pretty much anything to do with the diabetic foot and verrucas, or otherwise known as plantar warts.
Okay, so if you get diagnosed with any of those, then obviously you're the person to see.
I'm the one to see.
So a lot of people get foot pain. Is foot pain normal?
So foot pain is not normal, and I'll tell you why. Typically once someone has foot pain, it's already kind of the end stage. So the longer you leave something like that, the worse it can get. So if you are experiencing any sort of foot pain, I would suggest going in to see a podiatrist. Reason being is once you already have that pain, it does get a little bit harder to treat.
Weird question. Are you a pediatrician?
I am not a pediatrician. I do get asked that a lot because of the name. So pediatricians are medical doctors that specialize in children and sort of those sort of conditions. However, we do see some sort of kids in terms of, you know, sometimes parents are worried about how their kids are walking, or they're just complaining of pain which may not seem normal or just out of the ordinary.
Yeah. So you're not a medical doctor that's going to treat my newborn with the medical history?
No.
Okay,
no.
cool. Bonus question, are you going to prescribe me orthotics?
Highly unlikely that I will do that. Reason being, there is a case for orthotics in certain aspects, but we believe in sort of treating what's causing the issue as opposed to just the pain itself. So just slapping on an orthotic and giving it to someone is probably less likely for me to do that.
Then in what cases would you give someone the orthotics?
In certain cases when the pain might be a little bit more severe and we're trying to work on other things, we'd probably give the orthotic as a sort of a secondary accompaniment to, say, exercise strengthening and other treatment protocols or other treatment programs that can actually accompany the orthotic therapy itself.
Yeah. So orthotic is used as one of the tools in the treatment to help assist the other things that you're doing for that period of time.
Yeah, exactly right.
Okay.
Exactly right.
Cool. I think all my top 6 or 7 questions are answered.
Perfect.
Awesome.